All right. Hello to the Seattle University community and my wonderful colleagues, Amy and Michelle. My name is Annie Gordon. I use she, her pronouns, and I serve currently as the program coordinator for alcohol and other drug education in the Office of Wellness and Health Promotion on campus. And one thing that we have really been noticing, both in my office and kind of throughout campus, is that students are really getting online and asking a lot of questions during this global pandemic, which has been so trying for us. And so the three of us here thought that we would come together and maybe try to answer some of the questions, knowing that we would love to be sitting in a room in person with you, but we thought this was the second best thing. So I'll pass it off to Amy to introduce herself as well.
Hi, everybody. My name is Amy Coonerty-Femiano, and I am and I use she, her pronouns, and I am one of the psychologists who works at CAPS. And so Annie asked me to join you all today for this great conversation.
Thank you, Amy. And I'm Michelle Harper Kowalczyk. I also use she, her pronouns. I serve as the Associate Director in our Center for Student Involvement, particularly working with leadership programs and student governments.
Great.
I'm happy to be with you today.
Thank you, everyone, for being here. So we have just a handful of things that we're kind of going to go through and flow through. That'll be pretty conversational, but just to kind of get us started, Michelle, I would love to hear a little bit from you, knowing that you work in CSI. How are folks and students staying connected during these times, and what challenges have you seen with that?
Absolutely. That's a great question, because when we first started going online over at the very beginning of this quarter, we had a lot of the same questions, club leaders in particular, asking how can they stay involved, what resources are there. So what we've been hearing from clubs and students at large is that they're being really intentional to create spaces. We have colleagues across campus that are creating affinity spaces for students, students with particular identities coming together and sharing and holding space together. RAs, it seems like there's an RA event every day. I don't know if you've been on the Connect SU events page lately. It'll list out a lot of the events that are coming up. So if the students watching, if you live on campus, there's virtual cookouts and art classes, and it's been really beautiful to see. So I think part of it is those that are trying to hold space, we're like really amping up our game right now. Our clubs, I know many of them are continuing to be active through the summer. So being in touch, staying informed about what clubs we offer, how to get in touch with them, and checking up on the events that they're having, that those have been really powerful. I know they've been really, I want to talk about, you asked the question about barriers, and I feel like many of us know the barriers, right? Like it's sometimes difficult to get everyone together. There's been concerns around tech and time zones, and they've just been so creative. Clubs that have like turned a Zoom meeting into like a scavenger hunt, right? Like you're working in your different rooms and you each have your own task, or board game nights. So I believe that there's a lot of models out there. And so if a student who's watching is interested in holding space for other folks, maybe initiating something with friends or family, some of the really some that we've seen a lot are virtual board games. We've heard of Jackbox and House Party and Pokey, places that you can do things online. Virtual Netflix or other streaming pieces. I know there's a local Seattle company that one of our students works for that everyone gets their own avatar and you're like in the movie together. It's very interesting. Mm-hmm. So like going on a walk together with some of the virtual like museums and parks. Some of the more creative, like ones that I've seen is there's a club that's been collecting reflection questions, and they because we know they want people to come together and hold space, and people want to be there, but sometimes it's like, so what do we talk about? So just soliciting questions or looking up online, like, would you rather questions that can be as serious or as deep as you want, but sometimes having those prepared ahead of time can really help spark a conversation and turn what can sometimes feel like the awkward Brady Bunch screens into authentic human connection. And so I think the last piece, if I can, is that students who are struggling, trying to figure out how to do this, a one-stop shop, you could come and reach out to us in the Center for Student Involvement at seattleu.edu, or any other way that you want to reach out to us, social media, whatever. Because we've been holding roundtables for students that these questions sparked us to get students together to talk about how do we create those spaces. And there's also, we're planning to continue that, and we'd love to get other students beyond those that we've already been reaching into those spaces, so that we're in this together. I know it sounds cheesy, but we're all learning together, so we'll figure it out. We're happy to help you in that.
Oh, thank you, Michelle. That's so incredible. And for folks watching, we'll be sure to include all of the resources Michelle talked about in our notes for the video too. So you'll be able to find those. And just a huge shout out to CSI. You all are doing some incredible work to keep folks connected. And one thing that really resonated with me is you were speaking a lot to, I think, this culture of people wanting to stay connected, and that is so powerful during this time. I know one thing in my role that I've been thinking a lot about is different types of cultures and how those are manifesting in these online spaces. And I'm curious, maybe for you, Amy and Michelle, what you have kind of understood as we, knowing that I work in alcohol education, and so it's a little bit of a different lens. I'm curious how you all have kind of heard and interpreted concepts of Zoom happy hours and these kind of online cultural spaces that might include different substances and things like that, if you've heard those terms.
Absolutely. If I can, yes, I have. So I know that when we have events on campus, some of the things that we talk about with our event planners is what sort of things are insinuated in your programming, what expectations or pressure are you putting in the space. So when we were hosting events in person, we would have explicit conversations with students around anything called a happy hour, because for many folks, we know that can be triggering or cause anxiety for those who choose not to drink, or who are abstain, or who are working through an addiction. That how we set up the space, and we could call it something else, like a coffee hour, doesn't have the same weight with it, but has the same meaning. So yes, I've definitely been seeing a lot of the Zoom happy hours, and I know that when we were in person, we would have more conversations around it. And I'm curious what that's looked like from your end, since we've been more virtual.
Yeah, and I was just thinking too, since we are more virtual, some of these hangout places, it kind of depends, I think, on what assumptions are being made. When we were in person, maybe talking about alcohol being present, and now that we're virtual, sometimes I'm wondering if happy hours are just kind of a code for can we hang out, and the language is still carrying on, but the alcohol is, doesn't necessarily come with it, since we're not at a bar anymore. So it's just interesting to kind of think about different ways that people are experiencing that, and if they feel if it's a virtual happy hour, is the same pressure there, or is it different because it's virtual and you're just kind of in your kitchen and you could have a sandwich and a glass of water and enjoy your social time. So it's just kind of depending, I feel on how people are thinking about it. And I feel different things are getting redefined now in this more virtual age, and thinking about all the different ways people hang out, with the House Party app or Netflix, or whatever it is, and just hoping that people can kind of expand the definition of some of these virtual hangout spots.
Yeah, I think that's so interesting. Kind of this, I don't know, maybe gap between, I think there are probably a lot of folks who, like you said, Amy, are really just looking to extend an invitation to be in community with folks. And then I'm also, and so I'm thinking about that and wanting to honor that and keep folks in community, while also recognizing kind of some of these nuances in, I don't know, identities related to drinking and reasons why people might not be drinking, whether that's mental health or religion. And I'm wondering, just knowing based off of, our data around perception of how many students are drinking, we know that overall, about 1 in 3 students on our campus don't drink regularly. But students think that like 96% of students are drinking all the time, and so there's that big gap there. And, I know in our office and across campus, it's really important to us to create these non-judgmental spaces for folks to talk really openly about their drinking. And so, for students who are drinking, we love to have those conversations of, what's your relationship with alcohol? How are you doing so in a lower risk way where you're still enjoying your time and feeling free to do so, while also kind of trying to mold that with space where we can maybe kind of minimize pressure that some students might feel. If you get an invite that says, we're doing a happy hour online or whatever, I'm curious for those of our students who are not drinking for a variety of reasons, if that might kind of bring up some, oh boy, like, well, how do I stay included here? Especially knowing that we're lacking right now those maybe kind of in-person norms that would maybe be set. So yeah, I think those are, I don't know, interesting things to think about as we try to think about as a campus and as a community and culture, how to continue to create these really great spaces where we're honoring all of our students' decisions regarding their relationship with alcohol, and also trying to, continue to create spaces that feel safe for everybody. Yeah, I don't know. One thing that I have kind of been thinking about is anecdotally, just in conversation with folks and in the office, we have heard, this concept of people are drinking more right now, which is just kind of a general statement that has no backing behind it, right? It's just like an anecdotal thought. And I have a couple thoughts about it. One of my thoughts is that, I don't know that we need to catastrophize drinking necessarily. Like if folks are enjoying a drink responsibly, that is totally one thing. And then I also think about maybe our students who are maybe feeling concerned or curious how they might, interpret seeing folks around them drinking more. And so, yeah, I don't know. I wonder if anyone has any thoughts about kind of that concept of identifying concerning behaviors, and also what's appropriate as a friend, and kind of staying true to being inclusive, non-judgmental, all of these pieces.
Yeah, I think you bring up a really good point, because I think it's important to kind of remember this context that we're all kind of living through a pandemic right now. And I think all of our survival buttons are just pushed. And so we all react in different ways when that happens. And so we're just kind of all coping differently with this kind of loss of this life that we once knew. And I think it's important to kind of hold space for all the different ways that that people are coping with this, because it's something that we never have experienced before. So I think people don't know what to do. But you do bring up being concerned about a friend, which is important, because I think also in this time, it might be harder to know how a friend's doing because you're not with them. By the same token, I know a lot of people who are roommates, now they're really roommates. They've gone from, roommates who see each other sometimes to like, oh, we see each other 24/7. Yeah. So it can be kind of a different way to be concerned about somebody if you're actually around them all the time. And I think it's important, if you are concerned about a friend, to think about what you were just saying, Annie, about how to kind of talk about that from a non-judgmental stance, and just to let them know that, whatever your concern might be. And when I think about, if you're concerned about a friend, it could be about drinking, and it could be about anything. And so when we approach our friends that we're concerned about, just approaching them with that care and that concern, I think is kind of the most important, kind of approaching it with that non-judgmental care, like, I care about you. I wonder how you've been doing lately. And I think it's important to kind of focus on what you're noticing, because I think it can be hard because we all have different views on drinking, right? And so for one person, they might come from a history of alcoholism, and so they might see something in their friend and that really triggers something in them. So they might want to be like, you drink too much, where in reality that might not land well. Whereas if they go up to their friend and they're like, oh, hey, I've just noticed that, sometimes at night you go in your room and I notice you bring alcohol with you, but then other nights you're hanging out with us in the living room and you're social and you're not drinking. And I was just curious, how you're doing. So I think they're just really non-judgmental ways that you can kind of approach it without bringing your judgment about drinking to it. Because I think it could be a hard topic for someone to talk about, because maybe they are concerned about their drinking, but they don't want to talk about it. Or maybe they're not, and they don't want to talk about it. So just be able to kind of hold space. And I think if it's impacting your relationship with your friend, and I think it's really hard now virtually if you don't see them, right? So they could be really out of touch with you lately because they're having a hard time coping, or it could be because they're drinking, like you don't know. So I think it can be harder sometimes to reach out virtually in that way, because people are like, well, what do you do? Because I think that people are used to that organic connection, like you see them in class and you chat and that's fine. But now reaching out virtually, I think, can be a little bit more challenging. But I think reaching out is really the take home message if you're concerned. Even if they don't end up talking to you about it, you reached out and you expressed your concern, and they'll remember that, so, and that might open the door for them to talk about it, or might open the door for them to know, oh, cool, my friend cares. That's good to know,
Definitely. Thank you.
I'm curious.
Oh yeah.
I was going to say, I'm curious for the two of you, for either somebody who wants more resources to figure out how to have that conversation with a friend, if there are any like specific ones online that y'all use, or if somebody is seeing something in themselves that they're wanting to talk to somebody or explore options for spaces where they can be and like what resources exist for that.
Yeah. Annie, did you want to take that, or do you want me to take that one?
Yeah, no, I'm happy to jump in and you can fill in if I'm missing things. But no, I think that's a super great question, Michelle, and something that I know in our office we hear from students a lot, and I would guess in other spaces too, right? This, how do I navigate this? So in wellness and health promotion, we have a good amount of resources, mostly through, staff members who have, put on programming around this, how to help a friend is the name of the program. And so knowing that, reaching out can be hard, but also knowing that, we have virtual office hours. And so more often than not, if you hop onto our website, you'll get the little notification that someone is here and eager to chat if you're willing. And so if folks are comfortable, starting that to just say, hey, I've been thinking about it, I'm curious about, how I might navigate this. We have a lot of staff members who would be more than happy to kind of personally speak on that, right? And then regarding, personally, let's say I want to maybe think or learn a little bit more about my own relationship with, if we're talking specifically about alcohol, but this could also be true for thinking about my own mental health. We do have a variety of different anonymous screening options that are all available on our website, and I'll link them in the notes here too. And what that looks like is, so you would be able to go on and there's a variety of different options, right? I want to learn more about my drinking. I want to learn more about anxiety, whatever it might be. And then the student can go through and fill that out for themselves. And then if they decide that they want to, it's certainly not diagnostic, right? It's not it's not going to come out with some conclusive statement. But what it will say is that, you know, something to the effect of, depending on where your answers are leading, it might say, you know, it might be helpful for you to talk to a counselor about this, or it might be helpful for you to, you know, think about this more, or what, you know, whatever that might look like. And so in that case, we certainly are always happy to hold space for students to process. And in our office too, we are really cognizant of that line where it starts to look like, you know, we might want to refer to folks over in CAPS if it's looking like the conversation might benefit from, you know, clinical psychologists, rather than just kind of an initial process. And so those are a couple of different resources that I can think of. And I know too that in the alcohol and other drugs section of our website right now, we've also updated it for students who are maybe actively in recovery or thinking about those things. We've updated it with a variety of local resources that have moved to being virtual, in addition to a couple of AA resources that allow you to enter kind of your zip code first, knowing that a lot of our students are not in Seattle right now, so that you might be able to find phone meetings or virtual meetings more local to you. And so certainly a variety of resources available depending on what students might be seeking. And with all of them, the very open and warm invitation to reach out to folks in our office if folks need to process or talk through anything. Anything to add, Amy?
No, I mean, I actually think your office is a great place to start. Our website also has screenings for alcohol and other concerns. So there's screenings at both places. And then our office can also provide you with referrals. So if you actually know that you're interested in something specifically, you can call our office and they can provide you with off-campus referrals. And then we're currently, we can only see students in Washington right now. So for those students who aren't in Washington, they can still call our office. So if they have a conversation with you, Annie, and then they want a referral, they could call our office and say that they're not in Washington. And our case manager can help you find referrals wherever you happen to be. Yeah.
That's great.
And there's also the, I don't know how many students are familiar with the Semvelo app, but I know that's an app that your office has talked a lot about, Annie, and I wanted to mention it because not only are there lots of things on there around mental health, but there is now a community forum on there, so you can kind of talk to others in the community about how you're doing. So it just might provide another opportunity to kind of connect virtually, not necessarily with SU students, but just in the greater community. So that's a good resource too for the students who have already downloaded it or don't know about it, and you can download it.
Yeah, it's a phenomenal free resource, definitely.
Yes. Yeah.
All right. Well, I'm so appreciative of the both of you coming together and sharing this space today. I think we had some really meaningful conversations, and hopefully whether folks are looking and thinking about how to stay connected or thinking more specifically about these kind of intersections of substance use in this time of a global pandemic, hopefully we've got some good resources packed in here. So I'm so appreciative of you two bringing your knowledge to this space, and I'm eager for folks to see it.
Well, thank you so much for bringing us together today.
Thank you.
Thank you.